Hello, everybody. Thank you for joining us today. Hope everybody's doing well. Uh, Today's workshop is titled "Better." Sorry, give me 1 second. I'm in the wrong one. So today's workshop is called "Medication Management in Older Adults." Before I introduce our speaker, I'd like to review some general rules for the workshop. So everybody is muted right now. We ask all workshop participants that they do stay muted during the workshop. You'll know that you're muted if you see a red slash through the microphone icon at the bottom of the screen. All workshops are being recorded and they will be uploaded to our website at a later date for others to review. So if you want to check those out later on. If you do not wish to have your video appear in the recording, please disable your video, and you can do so by clicking on the video camera icon located at the bottom of your screen. To ensure that you have a good view of the speakers, go ahead and please select speaker view, where you can adjust the setting in the top right hand corner of your screen. Please type any questions that you may have in the chat box, and so there will be time at the end of the workshop for questions and answers. So with that said, today's speaker for this workshop is Dr. Laura Hart. A little bit about Dr. Laura Hart. Dr. Hart is a geriatric pharmacist and an assistant clinical professor at UC San Diego Skaggs School of Pharmacy and Pharmaceutical Sciences in the Division of Clinical Pharmacy. Prior to joining the faculty in September of 2018, she completed a specialty residency and fellowship in geriatric pharmacotherapy and served as an instructor in the Doctor of Pharmacy program at the University of Washington School of Pharmacy in Seattle, Washington. She is passionate about providing care to older adults, as well as conducting research in geriatric pharmacy, with a focus on fall prevention and dementia. So please join me in welcoming Dr. Laura Hart, and I'll let you take it away.
Thank you very much. I'm still seeing the Fall Prevention Awareness Week slide.
Oh,
looks like.
Thank you.
Yeah.
There we go.
All right. Thank you very much for having me today. I'm very excited to be here to talk to everyone about medication management in older adults. And because it is Fall Prevention Awareness Week, I will also be sprinkling in some information about falls and fall prevention as it relates to medication use. So next. So to provide a little bit of background about medication use in the older adult population, older adults use more medications than other age groups in the United States and are also at a greater risk for medication-related problems, one of which is falls. This is because as the body ages, it becomes more sensitive to the effects of medications. For example, there is a decline in how the kidneys and liver work and their ability to clear medications from the body. In addition, older adults often have multiple health conditions that warrant use of many medications that can interact with each other and increase the risk of certain side effects or medication-related problems such as falls. Next. I want to spend a little bit of time discussing the different types and classifications of medications and giving some background on safety of these different medication types. So the first type of medication I'll be discussing is prescription medications. So these are medications that are prescribed by a physician or another healthcare provider, and they are prescribed for and meant to be used for only the person that they were prescribed to. These medications can be picked up at a pharmacy, or some people receive prescriptions from a mail order pharmacy. Prescription medications are regulated by the Food and Drug Administration, also known as the FDA. Some common examples of prescription medications that you may have heard of are amlodipine, the brand name is Norvasc, which is used for high blood pressure, atorvastatin, The brand name is Lipitor, which is used for high cholesterol. And then levothyroxine, the brand name is Synthroid, which is used when someone has low levels of thyroid hormone. Next. Whenever you're prescribed a new medication by your doctor or other healthcare provider, it's really important to keep in mind a series of questions to ask and information that you should know about this new medication. So it's important to know the name of the medication, both the brand and the generic name, what the medication is going to be used for, how to take the medication and when to take the medication. Some medications need to be taken at certain times of day. Some medications are taken once a day, whereas others are taken multiple times a day. And sometimes medications require special instructions for how to take them, such as on an empty stomach or sometimes with food, sometimes separated from other medications. So it's really important to know all of those different directions around how to take the medication. Also, it's important to know how long the medication will be taken for. Some medications, like antibiotics, are meant to be used for a short period of time, whereas other medications are meant to be used on a long-term basis. The fifth question, when will the medication start working? Some medications, you can expect the effect to be quite immediate, such as if you take a medication for pain, it should help to start relieving the pain pretty quickly within the hour. On the other hand, some medications take much longer to start to have the effects, sometimes even up to weeks or months. For example, medications used for depression can often take several weeks until you start noticing the full effects of the medication. So it's important to know when to expect those effects to start. Number 6, what side effects can occur from the medication? And is there anything that you can do to prevent or manage those side effects? 7, what foods or drinks should I avoid while taking the medication? For example, some medications are dangerous when used in combination with alcohol because of increased drowsiness. Other medications have interactions with grapefruit juice, which can affect how the medication is cleared from the body. Number 8, will the medication interact with any of my current medications or supplements? So it's important to know if there's going to be an interaction of concern. Sometimes this means that a medication might need to be adjusted, or sometimes there are special instructions, such as taking 2 medications a certain length of time apart. So it's important to know how to manage those interactions if they exist. Number 9, what should I do if I miss a dose of the medication? There are often specific instructions on what to do if this occurs. And for some medications, this is much more important. So it's very important to know what to do if you happen to forget to take a dose of your medication one day. Number 10, what are the risks of taking the medication, and do the benefits outweigh the risk? As I mentioned earlier, because older adults are at greater risk of medication-related problems, it's always very important to weigh the risks versus benefits of a given medication. And number 11, how should the medication be stored? Many medications can be stored at room temperature. However, some need to be stored in the refrigerator. Some need to be out of direct sunlight. Some medications need to be kept in their original container. So it's very important to know how the medication should be stored. Oftentimes your prescriber or the physician who is prescribing a new medication for you will discuss some of these things with you. But oftentimes you can also get this information from your pharmacist when you go to fill the prescription. Next. I just want to show you really quickly how a prescription label is organized and some things to pay attention to. So let's start with the top right corner. We see local pharmacy. So that's the name and the address of the pharmacy. Moving along the top portion, we see highlighted, it says RX and the pound sign. So that means RX number or prescription number. That's a unique identifier for each prescription that the pharmacy uses for processing. Below that, we see the date that the prescription was filled. Below that, QTY stands for quantity. That's the amount of medication that has been prescribed, in this case, 30 tablets. Then refills shows how many refills are available for the prescription before you need to get a new prescription. And then also the date by which those refills must occur, or else the prescription is expired. Then below that, we see the name of the person who prescribed the medication, in this case, Dr. Jane Johnson. And then moving along the top, telephone number listed is the pharmacy's telephone number in case you ever have a question about your medication or need to get a hold of the pharmacy for any other reason, such as calling in to request a refill of a medication. In the middle portion of the label, we see the patient's name, in this case, John Smith, and then the name of the medication and the form, in this case, atorvastatin, 20 milligrams, and it's also the 20 milligrams is the strength, and then the tablet is the form of the medication. Below that, we see that atorvastatin is the generic name for the brand name product Lipitor. So oftentimes the label will contain both the generic and brand name. Often medications, people recognize them more by their brand name. So that's often included as well as the generic name. And then below that, we see take 1 tablet by mouth every day. So that's the directions on how the medication will be taken. The section below that shows the manufacturer, which is abbreviated MFR, and then a description of the tablet. So this is important because, for example, let's say you're organizing your medications and a couple of bottles spill at the same time. You can know which medication is which by looking at the description of the medication on the prescription label. And if you ever have any questions or if the medication in the bottle does not look like the description that you see, it's very important to contact the pharmacy to make sure that you have the appropriate medication. And then below that, we see discard after. That's the date that the medication is considered expired and should be discarded. And then at the bottom of the label, we see a caution statement. Federal law prohibits the transfer of this drug to any person other than the patient for whom it is prescribed. This is a federal warning that is mandated to be placed on every prescription label. So you will see that on the prescription label of any medication that you get from the pharmacy. And then if we look at the very right-hand side, we see an orange label. This is called a warning label or auxiliary label. These labels are meant to give precautions in case there are certain instructions that are important to follow when taking the medication, or there are certain things to look out for or side effects to be aware of, such as drowsiness, which is something that can increase the risk of falls. In this case, we see do not eat grapefruit or drink grapefruit juice while taking this medication. This is because grapefruit juice can affect how the medication is cleared from the body. And then on the far right-hand side, we see a barcode. And that is essentially used by the pharmacy as they are verifying and processing and filling the prescription. Next. When you get a prescription medication from the pharmacy or receive one via mail order, it contains something called the patient information leaflet, which is essentially like a brochure that's provided to give you important information about the medication, such as what it's used for, how to take it, potential side effects, any warnings or precautions to look out for, one of which might be falls, and then also storage instructions, to name a few examples. Again, this information oftentimes will be covered by the pharmacist when you pick up a new prescription, but you're given written paperwork along with it to reinforce some of those concepts. I know sometimes there's a lot of information that the pharmacist tells you, and it's helpful to have this information to refer back to. Sometimes the leaflet contains, excuse me, quite a bit of information that can be overwhelming to process. And so if you ever have questions about anything that you see in the leaflet or any concerns, it's always important to contact your pharmacy. Next. Here are some general safety tips when it comes to using prescription medications. First, it's really important not to share your prescription medications with others or to use someone else's prescription medications. Again, prescription medications are prescribed to and intended to be used only for one person, and it could be very unsafe to share prescription medications with someone else. It's also important not to stop taking a medication without first talking to your prescriber or your pharmacist. Some medications have very special instructions when they're to be stopped in terms of slowly decreasing the dose over time. Because some medications, if they're stopped abruptly, can have dangerous effects, such as what we might call a withdrawal symptoms that can be very dangerous. Also, if you ever have any questions or concerns about a medication that you've been prescribed, always remember that you can call your pharmacist or prescriber as a resource to ask those questions and get any concerns addressed. Next. Over-the-counter medications are also abbreviated OTC medications. These do not require a prescription, and they're also known because of this as non-prescription medications. These can be purchased off of the shelf directly by you from whether it's in a local community pharmacy or a store such as a grocery store. Like prescription medications, over-the-counter medications are also regulated by the Food and Drug Administration, or FDA. Some common examples of over-the-counter medications you may have heard of are acetaminophen, the brand name is Tylenol, diphenhydramine, the brand name is Benadryl, and ibuprofen, which has the brand name Advil. Next. I want to take a minute to kind of show you some things to pay attention to when you're looking at over-the-counter medication packaging and the labeling. Next. So here's a close-up of the front of this box. We see the medication name Benadryl, and in yellow below, see diphenhydramine HCl. That's the generic name, and 25 milligrams is the strength. And then next to that, we see the word antihistamine, and that is the class that this medication belongs to. So Benadryl is considered an antihistamine medication. In the little pink box below that, we see what it's used for. So sneezing, itchy, watery eyes, runny nose, itchy throat. Next. I know this slide is a bit hard to see because the package labeling font is quite small, but when you look at the back or the sides of medication packaging for an over-the-counter medication, you'll see the active ingredient. So that's the medication. So in this case, diphenhydramine, and you'll see what it's used for. And then below that, we see warnings to look out for. So situations where the medication should not be used, also some things to look out for and things to avoid. So in this case, Benadryl can cause very marked drowsiness. And so that is something that can increase the risk of falls. There are also directions for how to use the medication and the maximum number of times or number of tablets per day that should be taken. There's other information provided, such as storage information. And then also the package label contains what are called inactive ingredients. So these are other ingredients that are used in creating the tablet or capsule or liquid or whatever the dosage form is. And this is important to look out for, especially if you have allergies to certain ingredients, such as certain dyes. Next. And I want to provide some examples of product labeling and show how it can be sometimes confusing because there are so many different products that are sometimes available that have the same brand name, but are either different forms, such as capsules or tablets or liquids, or might have different ingredients. So I'm using this example, Robitussin. So we see all the Robitussin products shown on this slide contain the same ingredients, which are dextromethorphan and guaifenesin. and these are used for cough. However, the different products are different forms. So we see an extended release tablet, we see capsules, as well as a liquid. So there are different forms, so it's important to pay attention to what that form is. Next slide. However, at the same time, there are also other products marketed under the same Robitussin name that have different ingredients than what we just saw on the last slide. So the first one you see here contains just the ingredient dextromethorphan. The middle one, we see this contains acetaminophen, which is the same thing as Tylenol. So it's often, it's common for acetaminophen or Tylenol to be included in a lot of different combination products that are available over the counter. The last one on this slide contains, in addition to dextromethorphan, a medication called doxylamine, which is very similar to Benadryl, and it causes sleepiness. So we see that this is a nighttime version. It says nighttime cough. And so whenever you see the words nighttime or PM on a label, and sometimes it's almost hidden, but it's important to pay attention to that, because that means it will contain something that can make you sleepy, and those ingredients can also increase the risk of falls. Next slide. Next, we see even more examples of products that have the name Robitussin but contain various ingredients. So once again, I just want to emphasize the importance of reading the package labeling carefully to know what exactly is contained in the product. And it's very easy if there's multiple products with the same name and you can see this packaging looks very similar. It might be easy to grab the wrong product and accidentally pick a product that contains diphenhydramine, which is again Benadryl, which can make you very sleepy and is actually considered a medication that is oftentimes unsafe for use in older adults because of the side effects it can have, such as falls. In addition, a lot of these products contain acetaminophen, and this is once again contained in many different over-the-counter products for even other types of health conditions. And if acetaminophen is used in excess, it can cause damage to the liver. So, for example, if you're already taking acetaminophen for another condition and you end up taking more acetaminophen that's hidden in a product that's available over the counter, it could potentially be considered too much and could be dangerous because of the effects that it has on the liver. Next. So some general tips for staying safe with using over-the-counter medications is I advise to always consult with your pharmacist, physician, or another healthcare provider before you start a new over-the-counter medication. Although these medications are readily available and do not require a prescription, they might have dangerous side effects, including increased risk of falls. So once again, medication products that contain diphenhydramine or Benadryl can increase the risk of falls. There's other types of ingredients that can also increase the risk of falls or have other dangerous side effects. And over-the-counter medications can also interact with your other medications. So it's very important to make sure that if you're going to be using a medication available over the counter, that you select one that's going to be appropriate and safe. And if you pick the medication, if you're purchasing the medication where there's a pharmacist nearby, it's very important to get their insight, and especially if you have any questions or concerns before selecting a product. And once again, it's important to read the package labeling carefully because, as we discussed with the Robitussin product examples, there can often be many different forms that have the same brand name and have similar packaging. It can be easy to select an inappropriate product, one that you didn't intend to select. And it's also important to read the labeling for important instructions on how to use the medication and to get a sense of the warnings and precautions as well. And again, Be cautious when it comes to combination products. So that is when a product contains multiple active ingredients. So it's once again important to read the label carefully to know what is contained in the product. And in general, I advise to use single ingredient products whenever possible, because this is often going to be the safest approach to reduce the risk of unwanted side effects. Next. The last class of medications, which is actually technically not considered a medication, but I lumped it in here because these are commonly used, is dietary supplements. So dietary supplements contain ingredients that are meant to supplement or enhance the diet, and they consist of either vitamins, minerals, herbal products, enzymes, as well as other ingredients. And these are regulated by the Food and Drug Administration, or FDA, just like prescription medications and over-the-counter medications, but they are regulated under a different set of regulations. So unlike medications, supplements don't require approval by the FDA before they're marketed or sold. Some examples of supplements that you may have heard of are calcium, vitamin D, fish oil, glucosamine chondroitin, and St. John's wort. Next. Once again, dietary supplements are not considered medications. So manufacturers of the supplements are allowed to say that the supplement promotes health or supports a certain function in the body. So you might say that it supports brain health or promotes brain health. However, any claims that a manufacturer of a supplement makes about their product must be followed by a statement that says, this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. One thing I'd like to point out is that while dietary supplements are not considered medications, they do have chemical and biological activity like medications do. So this means that they may have side effects, and they may actually have interactions with medications and other dietary supplements. And sometimes these interactions can be very dangerous. Next. In terms of the labeling of a supplement, you'll see on the packaging something called supplement facts, which gives you information about what is contained in the supplement and the serving size. So we see the different ingredients in the product as well. So this product contains vitamin A, vitamin D, and then omega-3 fatty acids. And we also see other ingredients that are contained in the supplement as well at the very bottom. And once again, that's important to pay attention to in case you have any allergies or perhaps dietary restrictions. For example, if you avoid products with gelatin, you'll be able to see if a product contains gelatin under the ingredients section. Next slide. One thing that's important to look for if you do end up using a supplement is to pick a product that has something that's called the USP verification mark. So on the bottom right, you see a seal that says USP, and then around that USP, we see a circle with dietary supplement verified. So this essentially ensures that a product has gone through extra review, and it will ensure that the product contains the ingredients that are listed on the label. So it contains what it's supposed to in the amounts that are stated, that it does not contain harmful levels of certain contaminants, that it will break down in the body and be released into the body in a certain amount of time, and has also been manufactured according to FDA good manufacturing practices. So like I mentioned, because dietary supplements are not regulated in the same way as prescription and over-the-counter medications, there is much less oversight in the manufacturing process. And so looking for this USP verification mark can help to ensure the safety and quality of the product. Next. So some tips regarding safe use of Supplements, like with medications, it's very important to always consult with your pharmacist, physician, or other healthcare provider before starting a dietary supplement, because once again, they can have side effects, they can have interactions. It's important to read the label carefully and be aware of all ingredients that are contained. There are some supplement products that contain multiple ingredients, and if you're taking multiple supplements, there might be an overlap of ingredients, and sometimes you might be taking excess of a certain ingredient. Selecting products with the USP verification mark, again, can help to ensure safety and quality. It's also important not to assume the term natural means safe. So many people assume that because something is a dietary supplement, that it automatically will be safe. Unfortunately, that is sometimes not the case. Once again, supplements are not regulated in the same way as prescription products, and some ingredients can have side effects or interact with medications. And it's also important not to use a supplement as a substitute for a prescription medication or a healthful diet. And lastly, be wary of false claims. So you might see advertisements for supplements that have, they give outstanding reviews and claims that a product will, promote brain health or a certain other function in the body. But oftentimes, if it sounds too good to be true, then it probably is. Next. So now that we've talked about prescription medications, over-the-counter medications, and supplements, I want to provide some general medication management tips and some tips for staying safe with medication use overall. So one thing that is very important is to keep an updated list of all the medications, prescription and over-the-counter, as well as supplements that you're taking, and bring this list to every healthcare appointment and visit at the pharmacy. In addition, if there's ever any changes to your medications, it's important to report this to all healthcare professionals involved in your care so that everyone stays on the same page. And then if you ever have any concerns about side effects or safety or other concerns, make sure to report those to your physician or pharmacist as soon as possible. Next. Another important piece of advice is to use only one pharmacy to fill your prescriptions, if at all possible. I know that sometimes I've had patients who will fill prescriptions at multiple pharmacies because of cost savings or convenience. For example, they're at the grocery store and there's a pharmacy there, so they decide to get a prescription filled while they're there, but their other prescriptions are filled at a different pharmacy, or perhaps mail order is used as well. However, when that occurs, the pharmacies are not generally going to all be on the same page or have the complete information about your health, your history, your other medications that you're using to make the best decisions possible. And so the safest thing is to use one pharmacy, if at all possible, to fill all of your prescriptions so that that pharmacy has all the information they need to ensure the safety and appropriateness of your medications. It's also important to take medications only as they're prescribed or directed, not to take too much or too little. When it comes to medication refills, it's important to request the refills early enough so that you don't run out of a medication. It's also important, again, not to abruptly stop or change your medications without first consulting with your physician or pharmacist. Sometimes this can be dangerous, so it's very important not to stop a medication or change a medication on your own. Lastly, it's important to not share your medications with others and use others' medications. As I described earlier, this can present a safety concern. Next. Some other tips for medication management is it's important to keep medications organized at home. So often it's, keeping medications in one place, and it's important that the place where medications are stored is cool and dry. unless medication requires refrigeration or other special storage instructions and needs to be stored separately. It's important to store medications out of reach of children or pets, and also not to mix different medications together in one container. I have seen situations where a patient has essentially dumped all their medications into one giant container, and this can be very dangerous. All the medications get mixed up, it becomes hard to tell them apart. And then one thing I want to say is that many people I have seen have mentioned that they've stored medications in the bathroom, and in the bathroom, we have oftentimes something called a medicine cabinet, which oftentimes makes people want to store medications in there. However, because the bathroom can become warmer and there can be a lot more moisture, it can actually affect how medications break down. And so it's important not to store medications in the bathroom, but rather in a cool and dry place. And then if you have old or expired medications, it's important not to keep these around and to make sure to discard them appropriately. And then lastly, if you ever have questions about your medications, it's important to ask these of your healthcare providers, just to make sure you have all of your questions answered and your concerns addressed in order to stay safe with all of your medications. Next. So now I want to touch upon this topic of a medication list, which I introduced just a while ago. So once again, it's important to keep a medication list and make sure to keep it up to date. So anytime a medication is added, changed, or removed, it's important to make this change to your list as well. And you should show this list to your physician and pharmacist if you're ever starting a new medication. That way they can be better aware of potential drug interactions or other safety concerns. It's important to bring the list to every healthcare appointment and visit to your pharmacy, and also to give a copy of your list to close contacts, such as a family member, someone who lives in your household, in case of an emergency. And so, for example, if you have to go to the hospital, your close contact can give this list to the hospital so that they know which medications you are taking at home. And this helps for being safe in terms of medications that are given to you in the hospital. And then lastly, I recommend regularly reviewing the medication list with your healthcare providers to determine if you still need all of the medication. Sometimes a medication is started and it might not be meant to be continued for long term, but it inadvertently gets continued for a longer period of time. Or sometimes a medication might be started and it was considered safe earlier on, but as the body changes and how that medication is processed changes, it may be considered unsafe, years down the road. So just regularly reviewing the medication list with your healthcare providers can really be helpful for overall medication management and determining whether you still need to be on all the medications that are on your list. Next. So now I want to discuss the steps for creating a medication list. So the medication list should include information about all of the medications or supplements that you're taking. So this includes prescription medications, over-the-counter medications, dietary or herbal supplements, and then all types of what we call dosage forms of medications. So tablets, capsules, liquids. Some medications come as ointments or creams or patches to be applied to the skin. So it's important to make note of those as well. Also, any inhaler products that you might use, for example, for asthma. Then any injection medications that you use, such as insulin. And then lastly, any eye drops or ear drops. So it's important to include all medications and supplements that you're taking. Next. And then there's other important information to include on your medication list, including your name and date of birth, the date that the list was last updated. So this can be very important, especially in case of an emergency, to know if it said the list was last updated in 2015, then the person reading it knows that it would not be necessarily as accurate of a medication list as if it was updated in 2020. So it's important to note the date that it was last updated. Also, if you have any allergies to medications or foods, it's important to note this along with the reaction. So you might be wondering why to report food allergies. Well, for example, in individuals who are allergic to peanuts, some medications actually are manufactured with peanut oil, and so this can be dangerous. So it's important to know medication or food allergies, or again, like I mentioned, if allergic to certain dyes that are often contained in medications, that should be noted as well. And then the reaction that occurs. So did you have swelling, a rash, itchiness, trouble breathing? It's also important to make note of your vaccine or immunization history to make sure that that is up to date. Also including the name and phone number for your primary care doctor, as well as the name and phone number for the primary pharmacy that you use. And then lastly, emergency contact information. So that if there's any questions about your list that you're unable to answer, someone else can clarify information if necessary. Next. So this provides an example of what a medication list might look like. So there's placeholders to list the different things we discussed on the previous slide. And then in the bottom portion, we see a place to actually list out the different medications. And it's important not just to list the medication name, but also to list the form, whether it's tablet, capsule, liquid, eye drops. It's also important to note the dosage and instructions, so how you take the medication. So in this example, we have 20 milligrams once daily. It's also important to note why you're taking the medication. In this example, it's for high cholesterol. But some medications are used for multiple different purposes, and so this is why it's important to note what you're using it for. And it also can help you keep track of your medications and what medications are being used for what condition. It's also important to list when the medication was started. And then in the next column, we see stop date. And some medications, like I mentioned earlier, are meant to be used for short periods of time. And so if that is the case, then you can indicate when a medication is stopped. And then lastly, listing the prescriber, so who prescribed your medication. And that helps not only you keep track if you have any questions, but also if another healthcare provider, if you give the list to them and they have any questions, they know who to contact about that specific medication if it is a prescription medication. But once again, in addition to prescription medications, it's important to list over-the-counter medications and supplements as well. Next. Lastly, I just want to touch upon some solutions for medication-related challenges that are commonly reported. So first is difficulty remembering to take medications. Some potential solutions, using alarm reminders, so setting alarm reminders on your phone or creating notes or a calendar. Some people find it really helpful to use what's called a pill box, also known as a MediSet, where you're able to fill that box with the different medications that are being used throughout the day. That can help, especially if you're taking medications multiple times per day. And I do want to point out that these potential solutions that I'm listing are definitely not all inclusive, and it's important to know that solutions are going to be individualized to the person, but I just wanted to provide some examples for you. Next, if there's difficulty reading prescription labels, you can ask the pharmacy if they can print your label in large print. And then also there are certain assistive devices that can help with reading prescription labels as well. So there's actually some pharmacies that have technology where the medication bottle actually can talk, and it tells you information about the medication. So instead of reading it, you would be able to hear that from the bottle. If there's difficulty hearing instructions from healthcare professionals, written information can always be very helpful in this case, or if you're able to have somebody accompany you to appointments who can help get the information as well, and also various assistive devices are available. If you have difficulty opening medication bottles, you can ask the pharmacy for what's called easy open caps. So by law, pharmacies are required to dispense medications with child-proof caps in order to keep children safe and from accidentally ingesting medications. So if you do want medication bottles that have caps that are easier to open, you can ask for easy open caps, but you will likely have to sign a waiver acknowledging that you're making this switch, and because these medications can be opened more easily by children. If there's difficulty swallowing tablets or capsules, sometimes it's possible to switch forms of the medication. So there might be a liquid form available that could be easier to use. In some cases, tablets can be crushed and sprinkled in food, or capsules can be opened, but this is not the case for all medications. So I really want to emphasize that it's important not to crush a tablet or open a capsule without first consulting with your pharmacist or physician. In some cases, this can be very dangerous. So make sure to get advice from a healthcare provider before doing this. Lastly, if there's difficulty with scheduling many medications throughout the day, some potential solutions are, again, a pill box, also known as a MediSet, can help to keep track of the different medications. And then if you're feeling especially overwhelmed with your medication regimen or feeling like you're taking too many medications, you can always try discussing with your physician about ways to simplify your medication regimen. So for example, reviewing the medication list and seeing if there's any medications that might no longer be needed, or if there's ways to change a medication that's being taken twice a day. Is there another form available that can be taken once a day? So there's a lot of different potential solutions that are, so it's important to bring this concern to your healthcare provider. Next. So that is the end of my presentation. I really appreciate having the opportunity to talk to you all today, and I'd be happy to take any questions in our remaining time.
If anybody has any questions, you can go ahead and type it in the chat box. Meanwhile, just want to point out that we do have a couple upcoming, we still have a day left today, half a day, and a day left of Fall Prevention Awareness Week. So if you haven't already explored the rest of the workshops, we encourage you to go to www.sandiegofallprevention.org and see what the remaining workshops are. And I'm going to give it a couple minutes if anybody is typing in the chat box, if they have any questions. So we have one from Linda. Is the medication list form available?
That is a great question. So there are a variety of medication list forms available on the internet. For example, if you go to Google and type medication list or medication list form. However, I can also send the organizers some examples to be distributed if that would be possible or helpful.
Okay. Can definitely do that. Yes, if you do have it. So we have a follow-up. Everyone's saying, excellent presentation. Thank you. Good presentation, lots of information. And we have one, thanks. Can the presentation material be sent? Yes, I believe we will be making, we will be making the material and video available for this workshop on our site. All right, give it a couple more. All right. Well, if you have any additional questions that you want to ask our speaker, you can go ahead and email healthierliving.hhsa at sdcounty, sdcounty.ca.gov. I'll go ahead and post that shortly in the chat box, and we'll make sure to get those to Dr. Laura Hart. So thank you again for joining us in today's workshop. Special thanks to our speaker. And like I said earlier, if you haven't already explored the rest of the workshops, we encourage you to do so. Thank you for participating, and that concludes this workshop.